Duthie is going to be talking about a potential prophylactic agent for acute kidney injury.
First one. Fantastic, thank you. Yes, good afternoon. My name's Fiona Duthie. I'm a clinical research fellow up in Edinburgh, and I'm here to speak about the clinical trial that we've been carrying out, aiming to develop a prophylactic treatment for patients at risk of acute kidney injury at the time of their heart surgery. Apologies, there will be a little bit of overlap with Lauren Marston's talk from earlier on in the day, so bear with me. Right, acute kidney injury we know is having increased recognition as being a common problem that affects lots of patients, not just kidney patients. And it's important for patient outcomes because it's associated with both increased morbidity and mortality. We've looked retrospectively at patients in Edinburgh having heart surgery, which is a predictive insult to the kidney, in patients who are in a higher risk category. And our data is in keeping with other groups who have reported that the more severe your stage of acute kidney injury, the more likely you are to die while in hospital, and the more length of time you're likely to spend as an inpatient. And importantly, we identified the Euroscore, which is a mortality risk score used by the cardiac surgeons as the best predictor of acute kidney injury in this cohort. And we've heard about heme oxygenase 1 earlier on in the day. This is a key anti-inflammatory enzyme. We know it's important because patients who are deficient in it die early in childhood of a widespread inflammatory illness that affects the kidney. Heme oxygenase 1 is an inducible enzyme that breaks down heme, which is a ubiquitous protein found at inflamed sites, down into iron, carbon monoxide, which has anti-inflammatory and vasodilatory blood vessel dilatation properties, and biliverdin, which is subsequently broken down to bilirubin, which is anti-inflammatory. And we see that in action in our daily lives with the breaking down of our bruises. So heme is purple. It goes through the colour of green biliverdin into yellow bilirubin. And we've heard briefly about the preclinical work, which was funded by Kidney Research UK in Edinburgh and carried out by my colleague David Fernbach. He was looking at a mouse model of acute kidney injury. And what he demonstrated was that heme arginate, which is a drug licensed for human use, which has been used for over 20 years and has a good safety profile, when given to mice 24 hours prior to their experimental injury, protected the kidney from injury. And you can see that here. These are the control. This is injury up the y-axis. And the HA-treated mice had less injury than controls. And this effect was lost when the mice were deficient of macrophages. So we hypothesized that the macrophage expression of this enzyme is key. We've heard earlier about the HOT study, which was carried out in Edinburgh. These are in transplant patients, which is another example of ischemia reperfusion injury in the kidney. This demonstrated that heme oxygenase 1 was upregulated in the peripheral blood mononuclear cells, so circulating white blood cells. And although it wasn't powered to show a benefit to patient outcomes, there was a trend in a reduction in delayed graft function. So this brings us on to our work on the HACS phase 2 clinical trial. What we would like to do is to give this drug to patients at the time of their cardiac surgery to see if it protects the kidneys. Bearing in mind that this drug hasn't been used in this elderly and comorbid patient cohort previously that have obviously got cardiovascular disease, we wanted to first test it remote from surgery to see if we did what it think it does. Does it upregulate heme oxygenase 1? And importantly, is it safe? So we looked at 21 participants who were randomized to receive one of 2 doses of heme arginate. And we chose to include patients who are age 60 or above who are scheduled for elective aortic valve replacement or coronary artery bypass grafting. Our primary endpoint was HO1 protein in these peripheral blood mononuclear cells, secondary endpoints including gene expression of the HO1 gene, urinary biomarkers of acute kidney injury to inform future clinical trials, and importantly, safety. And this is just a schema of how we carried out the trial. So I would visit patients in their clinic and discuss the trial with them in clinic, If they agreed to participate, they would come up, they would be consented, they would receive the drug and be observed for a period of 6 hours afterwards. Study bloods would be taken before the drug and at 24 hours afterwards, and there'd be a follow-up visit again at 7 days to capture all adverse events. And we screened over 130 patients and managed to recruit 21, of whom 19 were male. They were elderly, so a median age of 73, and importantly, we had no serious adverse events. There were 7 adverse events in 5 participants. These were mild and none felt to be necessarily related to the study drug itself. And now the primary endpoint being HO1 protein in the peripheral blood mononuclear cells was a trend to significance but did not reach statistical significance either in the 1 or the 3 milligram per kilogram dose. Importantly, the gene expression was statistically significant, although to a lesser degree than in previous studies, both in healthy volunteers and in the HOT trial. This was at both doses, so 1 and 3 milligrams per kilogram. There was also a statistically significant increase in HO1 protein in the serum, although again to a lesser extent than in previous studies. And this raises a question about whether perhaps endothelial cell HO1 expression is important, and whether there's something different about this elderly comorbid patient cohort that means that they don't upregulate this enzyme to the same extent as previous studies have shown. So taking this work forward, we've demonstrated that heme arginate is safe in this older patient population with cardiovascular disease. It's not upregulated to the same extent as in healthy volunteers, but it is statistically significant in both the serum and in gene expression. It may be that it takes longer for the message to be translated in this patient group. We await eagerly the results of further clinical trials currently being carried out in patients receiving heme arginate to look at myocardial ischemia reperfusion injury, with the aim in the longer term to carry out a randomized controlled trial of heme arginate in patients at the time of their surgery with a view to seeing whether it reduces acute kidney injury post-operatively. I'd like to thank my supervisors and my colleagues at the Centre for Inflammation Research in Edinburgh, and in particular the Clinical Research Facility and the Cardiothoracics Department.
Sorry. Just asking why you think there may be some variation in the patients. I mean, the amount that things went up or down in some cases was hugely variable. And is that at all correlated with age?
It's not correlated with age or with other conditions like diabetes. And these are very low levels. So although it did look like there was a big variation, they're still quite, within quite a tight range of levels, if you like. So there didn't seem to be a particular correlation of that.
Just out of curiosity, what's the proportion of cardiac surgery patients that actually develop AKI as a consequence of that?
About 13% of patients, all patients, so all comers coming to have operations, certainly in our cohort, develop acute kidney injury.
Okay, and they develop what kind of grade of AKI? Is it the 13% 1 and 2 or 3 or
Yeah, so 1% would develop dialysis requiring acute kidney injury.
1%.
And they're generally the CK, the patients that have got pre-existing chronic kidney disease.
All right.
But yes, it's certainly more common to get the lesser grades of acute kidney injury, whereas the more severe dialysis requiring, so stage 3 and stage 3 RRT are the ones that are less common.
Okay, thank you.
But the cardiac surgeons recognise that as one potentially modifiable problem as part of their surgery. Do you know what I mean? There's an insult that's ischemia at the time of the operation, but protecting the kidney is one of the main reasons for their morbidity in their patients. So they're engaged in trying to improve outcomes from a renal point of view.
Great, thank you very much.